Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
Hi, and welcome to the Bee's Knees podcast. This is your host, PJ Ewing. I'm glad you're here. You're in the middle of 7 episodes, each one very short, each one very much to the point. In this case, we're going to talk about swelling, what is going on when you have swelling, why swelling is such a big problem, and how to deal with it if you have it after knee surgery. This is Lisa Alarcon, physical therapist from the state of Michigan. She's got vast experience with knees, all types of knee surgery recoveries, including total knee replacement. And she's got some real insight into what's really going on in the knee with swelling and what can we do about it if we've got it.
The swelling that occurs, the fluid that occurs in the knee, what it's composed of depends on how long it's been there. Okay, the longer the swelling is in the knee, if you've ever noticed, you can push on someone's skin and it stays dipped. Those patients have a lot more protein in that fluid. And so what happens as you get that fluid, the joint has a structure that supports it, okay, the joint capsule, and it's like a balloon. So the more swelling that's in that knee, the tighter the balloon gets. Once that balloon gets too tight, you have a significant limit in how much you can move your knee. Okay, when that happens, you don't move your knee because it hurts, it's uncomfortable, so you keep it still. Keeping it still only creates kind of this vicious cycle of now it doesn't move, so I can have scar tissue start to set up. Anytime you put a joint, and as you get older, as we all do, you put your body in a certain position and then you start to move out of that position and everything's like, oh, wait a minute, that doesn't feel so good. And that's also what's happening in a fresh knee joint, especially immediately following surgery. Those structures are not happy that they've been disturbed. They like to be where they are, they don't want to be cut, and that has all happened. And so the body's natural system says, I'm going to limit how much motion I want this knee to have, and so I'm going to send this swelling in.
Okay, that's it. A short and sweet podcast on a very important topic. Keep listening, keep sharing, keep commenting. All your feedback is welcome. You can reach us at thebeesnewspodcast@gmail.com. You can see a lot more great content at x10therapy.com. You can /blog or just look up any of the topics that you're interested in. We've got a wealth of content there. There are a number of private Facebook groups online that we support as well. So there's a whole dialogue going on that you can learn about when you get to the website. Thanks for listening. I'll see you next time.
To learn more, visit x10therapy.com, 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10, back to full strength.